The flow sheet is a very important document. It can be in the electronic medical record, but many units still have the paper form, and typically because it's a large amount of information to be entered, they have the A3 sheet for the NICU flow sheet. It includes daily assessment details like current weight, change in weight, intake, output, vital signs, the ventilation details, blood glucose, bilirubin, acute events, venous access, intactness of the venous access, and so on. It's very important to fill it in real time. It should not be a same value repeatedly, as you would look like it's cooked up values. So always be clear, always put it in real time. And if there is any abrasion or any vital sign out with the range, it's like the newborn early warning score. You have to inform the physician. Of course, the NICU team is fully versed with this, and they would call for help as soon as they think something is not right. So this is an example, the sheet we use in our unit. I'll be going into sections in detail, so don't worry about reading this big sheet. This is one part of it, and this is the breakup of this. So we have at the top the date, the age of the baby in days, birth weight, current weight, whether the baby is intubated, then the size and the length of the lips. These are important information, and this should be revised whenever the baby gets re-intubated. Intake and output is a summary based on what we will see next. The day nurse and the night nurse, and we would be using abbreviations in between, and you mentioned these initials alone so that you don't need to write in a small chart all the information. So if you put plus, it's agreed, mild, moderate, severe. P for pink, double P for pale pink, PL plethoric, J jaundiced, motile, cyanotic, G for grunting, R for retraction, S for shallow. So this is for the respiration and the appearance of the baby. Then the OG tube, again you mentioned incubator change date. Most units change it weekly. Umbilical arterial lines, UVC central line, and insertion date as well. So this reminds you to check their necessity on everyday basis during the rounds, which is good practice and is included in most care bundles. If the baby is on TPN, and also feeds, when it was started, how it's progressing, whether the newborn screening is done. And remember, preterm babies do need a repeat newborn screening. You can review my video on screening in preterm babies. And the ROP, so this acts as a reminder for these. And this portion of the sheet is for infusion, so the time is written downwards. Infusion fluids, you may have multiple infusions, so you have 3 columns like this. Infusion fluid, I have just taken 2 to show you better. The rate, the total that's going through at each stage, the pressure reading to make sure there is no obstruction or occlusion, IV line change if it was done in between, IV site check. So this is part of the IV care bundle as well, that we to avoid extravasation and also infection prevention, and the initial of the person who is recording it. So at the bottom of the page we have the grand total of IV fluids in ml per kilo per 24 hours as well, and again a review of the output from the intake from the IV access, then any output from the drain, Foley catheter if urinary catheter is there, ileostomy, colostomy if they are applicable, and GCS only if there is any concerns. Here we mention about allergies, mostly it's not applicable in newborns. And the provisional diagnosis and the primary physician are there because it's a daily sheet, and the nurses sign at handover as well. This is the back portion of the sheet, and again as I will come to it, it has sections for blood gas, ventilation, observations where we write the feed part as well, and assessments. So this is the blood gas section. So we have the vital signs recorded as well, and according to the time, temperature, heart rate, respiration, saturation, blood pressure. This is the mean blood pressure and the systolic. Pain assessment, NIP scoring, blood gases, if they are done, you enter it here as well, and we do get the reports in the system. When we are on ventilatory support, the mode is selected here. Volume guarantee, what is the ml per kilo you are setting. tidal volume that's actually measured, PIP, PEEP, set rate, trigger breath, inspiratory time, IE ratio. So remember that if you make any changes, you need to inform the nurse, so when they do it next time they would update it. Sometimes it gets missed out if you don't communicate, so it's a responsibility of whoever is making the change to inform. If it is high frequency, you need to write the settings accordingly. The FiO2 is important. Humidifier, it's always important to make this in the hourly check as well. So you check if the water is running out, you would fill it, and if the baby has suction, endotracheal, oropharyngeal, you would enter it here as well with these abbreviations. The observations include incubator temperature, incubator humidity, air entry, presence of recession, skin color, check for the nares to avoid injury, blood glucose in milligrams per deciliter. If there is any gastric aspirate, the urine output is measured here, the stool output is entered here, and positioning is important to rotate the position as possible. The feeding is entered under this part, so this will be added with the previous page, IV fluids and TPN, and then you would get the total intake for the day. Of course, this setup, depends. You may use a different chart, and the feeding may go with the IV part as well on the same sheet. Alarm limits. This is a reminder that you need to look at the alarm limits on everyday basis at every shift change. Sometimes we individualize the alarms. Most of the time the unit has specific alarm limits for gestation base and sickness level, so you follow that as well. So we have abbreviations on the right hand side of the sheet as I discussed in the beginning. So if you are entering under the suction column, these are the short forms. In the temperature column, if you put these observations, these are the short forms. And saturation, if there is a probe change. Air entry, if you are listening to the chest, this is what you mean. And positioning, supine, lateral, prone, so changing in position. So this is just a summary of the NICU flow sheet, and as I said, go through the sheet you use in your unit so you get a clear idea of what